Question number 1. Which ion causes rapid depolarization in a neuron? Correct option is B. Sodium. Question number 2. Which organ stores excess glucose as glycogen? Correct option is A. Liver. Question number 3. Which giant allows the widest range of movement? Correct option is D. Ball and socket. Question number 4. Which artery mainly supplies the brain? Correct option is D. Internal carotid artery. Question number 5. Which hormone regulates the sleep-wake cycle? Correct option is C. Melatonin. Question number 6. Which vitamin is required for calcium absorption? Correct option is A. Vitamin D. Question number 7. Which cell release histamine during inflammation? Correct option is A. Basophils. Question number 8. Which heart layer is responsible for contraction? Correct option is C. Myocardium. Question number 9. Which of the following gland controls metabolism? Correct option is A. Thyroid gland. Question number 10. Which neurofibers carry slow chronic pain? Correct option is D. C fibers. Question number 11. Which part of the nephron concentrate urine? Correct option is C. Lobe of Henle. Question number 12. Which brain part maintains posture and balance? Correct option is D. Cerebellum. Question number 13. Which muscle type is involuntary but striated? Correct option is B. Cardiac muscle. Question number 14. Which organ has highest regenerative capacity? Correct option is A. Liver. Question number 15. Which phase of action potential is caused by potassium efflux? Correct option is B. Repolarization. Question number 16. Which hormone increases basal metabolic rate? Correct option is C. Thyroxine. Question number 17. Which nerve supplies the deltoid muscle? Correct option is D. Auxiliary nerve. Question number 18. What is the major buffer system of blood? Correct option is B. Bicarbonate. Question number 19. What is the normal hematocrit in males? Correct option is A. 40 to 50%. Question number 20. Which organ is affected in Addison's disease? Correct option is the adrenal cortex. Question number 21. Which hormone is secreted by pineal gland? Correct option is C. Melatonin. Question number 22. Which ion mainly determines a resting membrane potential? Correct option is D. Potassium. Question number 23. Where is the fire's pitches located? Correct option is A. Ilium. Question number 24. Which bone articulates with humerus at shoulder? Correct option is C. Scapula. Question number 25. Which hormone increases calcium excretion in urine? Correct option is B. Calcitonin. Question number 26. Which organ is the primary site of hematopoiesis in adult? Correct option is D. Bone marrow. Question number 27. Which hormone regulates circadian rhythm? Correct option is C. Melatonin. Question number 28. Which type of muscle is found in uterus? Correct option is B. Smooth muscle. Question number 29. Which hormone increases heart rate? Question number 31. What is the safest antihypertensive in pregnancy? Correct option is C. Nifedipine. Question number 32. Which condition is associated with polyhydramnios? Correct option is A. Anencephaly. Question number 33. What is the main complication of severe anemia in pregnancy? Correct option is B. Heart failure. Question number 34. What is the most common infection causing preterm labor? Correct option is C. UTI. Question number 35. Which drug reduce afterload in heart failure? Correct option is D. AC inhibitors. Question number 36. Which lab value increases in myocardial infarction fast? Correct option is D. Myoglobin. Question number 37. Which medication prevents platelets aggregation? Correct option is A. Aspirin. Question number 38. The drug for hyperkalemia membrane stabilization is correct option is D. Calcium gluconate. Question number 39. Which enzyme level is most specific for myocardial injury? Correct option is D. Troponin 1. Question number 40. In acute renal failure, which parameter rises first? Correct option is A. Creatinine. Question number 41. Which condition requires isolation with N95 mask? Correct option is B. Tuberculosis.
Question number 42. Which drug is used to reverse benzodiazepine sedation? Correct option is the plasmonil. Question number 43. A patient with head injury has unequal pupil. This indicates. Correct option is B. Increased intracranial pressure. Question number 44. Which electrolyte imbalance causes muscle tetany? Correct option is B. Hypocalcemia. Question number 45. Which drug is preferred for rapid sequence intubation sedation? Correct option is A. Midazolam. Question number 46. Which drug reduce intracranial pressure? Correct option is A. Mannitol. Question number 47. Which lab value indicates syphilis progression? Correct option is B. High lactate. Question number 48. Which drug prevents gastric ulcer in critically ill patients? Correct option is D. Pantoprazole. Question number 49. The most common cause of chronic bronchitis is. Correct option is B. Smoking. Question number 50. The drug used for rate control in atrial fibrillation. Correct option is A. Digoxin. Question number 51. The best way to prevent childhood pneumonia is. Correct option is B. Immunization. Question number 52. A mood disorder characterized by elevated mood is. Correct option is A. Mania. Question number 53. Which type of immunity is provided by vaccines? Correct option is A. D. Passive immunity. Question number 54. Which diet is recommended for peptic ulcer disease? Correct option is a bland diet. Question number 55. A patient with acute pancreatitis should be positioned. Correct option is C. Polar position. Question number 56. Which sign is positive in upper motor neuron lesion? Correct option is A. Babinski sign. Question number 57. Which layer of the adrenal gland secretes mineralocorticosteroids? Correct option is the zona glomerulosa. Question number 58. A burned patient with 30% burns requires fluid calculation by which formula? Correct option is C. Parkland formula. Question number 59. Which electrolyte imbalance causes U wave on ECG? Correct option is A. Hypokalemia. Question number 60. A patient with head injury has Glasgow Coma Scale score of 8. This indicates. Correct option is C. Severe injury. Question number 61. Which disease is caused by vitamin D deficiency? Correct option is B. Records. Question number 62. Which test measures oxygen saturation in blood? Correct option is D. Pulse oximetry. Question number 63. Which electrolyte imbalance causes muscle cramps and tetany? Correct option is B. Hypocalcemia. Question number 64. Which condition is characterized by excess cortisol secretion? Correct option is B. Cushing syndrome. Question number 65. Which test is used to diagnose HIV infection? Correct option is a ELISA test. Question number 66. Which disease is caused by Plasmodium parasite? Correct option is a malaria. Question number 67. Which deficiency causes macrocytic anemia? Correct option is D. Vitamin B12. Question number 68. Which electrolyte is mainly responsible for narrow conduction? Correct option is B. Sodium. Question number 69. Which vitamin deficiency causes dry skin and eye problems? Correct option is A. Vitamin A. Question number 70. Which disease causes white patches on skin due to loss of melanin? Correct option is A. Vitiligo. Question number 71. Which organ is responsible for detoxification of drugs? Correct option is B. Liver. Question number 72. Which blood component is responsible for clotting? Correct option is B. Platelets. Question number 73. Which disease causes wheezing and difficulty breathing? Correct option is A. Asthma. Question number 74. Which condition causes excessive urination and thirst? Correct option is D. Diabetes mellitus. Question number 75. Which disease causes inflammation of kidney? Correct option is A. Nephritis. Question number 76. Which disease causes dermatitis, diarrhea, and dementia? Correct option is C. Falgera. Question number 77. Which disease causes severe itching and skin rashes due to mites? Correct option is B. Scabies. Question number 78. Which disease causes red scaly patches on skin? Correct option is D. Psoriasis. Question number 79. Which system is responsible for producing hormones? Correct option is B. Endocrine system. Question number 80. Which part of the brain controls balance and coordination? Correct option is D. Cerebellum.